Today's our topic is diabetic mellitus. So what is diabetic mellitus? The definition for diabetic mellitus is a chronic disease caused by inherited and or acquired deficiency in production of insulin by the pancreas or by ineffectiveness of the insulin produced. Such deficiency results in increased concentration of glucose in blood, which in turn leads to damage to many of the body's system, especially to the blood vessels and nerves. Next, we will see about insulin. So, insulin is a hormone produced by beta cells of the islets of Langerhans in the pancreas gland. So, insulin helps the metabolism of glucose for utilization in the body and store the excess glucose in the liver and the muscle as glycogen. So, insulin also helps in depositing in free fatty acids in the tissues. Next is the risk factors. So, people with any of the following factors have greater chance of developing chronic diabetes. So, first one is obesity, hypertension or any chronic illness, family history of diabetes, continuous stress. These all are the risk factors for the diabetes. Next, we'll see about the diabetes mellitus classification. So, there are three types of diabetic mellitus: type 1 diabetic mellitus, and type 2 diabetic mellitus, and type 3 gestational diabetic mellitus. So, type 1 diabetic mellitus is a B cell destruction, which is an immune mediated idiopathic disease, and type 2 diabetic mellitus is non-insulin dependent diabetic mellitus. Next one is classification of diabetic mellitus. There are mainly three types of diabetic mellitus: type 1 diabetic mellitus, type 2 diabetic mellitus, and gestational diabetic mellitus. So we'll see about diabetic mellitus 1. So type 1 diabetic mellitus is a B cell destruction, immune mediated and idiopathic condition. And type 2 diabetic mellitus is non-insulin dependent diabetic mellitus, mainly seen in after 40s, and may also cause to the family histories. Most of obese and glucose level improves on weight loss. And the last type, gestational diabetic mellitus, which applies only to women, appears during pregnancy and disappears after pregnancy is terminated. There are certain conditions caused by the secondary to diabetic mellitus: genetic defects of B cell function, genetic defects in insulin action, disease of exocrine pancreas, hormonal disorders like thyrotoxicosis, Cushing syndromes, acromegaly, cystic fibrosis, congenital rubella syndrome, CMV, surgery, Down syndromes, drug or chemical induced like pentamidine steroids, dilantyne. Next, we'll see about the etiopathogenesis. So, there are three factors: genetic, environmental, and autoimmune reactions. So, in etiology of type 1 are considered as environmental factors which cause due to the autoimmune reaction which leads to the inflammation of beta cell of pancreas. Inflammatory process stimulate beta cells which leads to produce slightly abnormal class 2 human leukocytes antigens, which leads to lymphocytes recognize these antigens as non-self and destroy them. This leads to releasing more B cell proteins can make additional human leukocytes antigens and stimulation and ongoing immune response, which eventually destroys all B cells, which increase the insulin. So this is the etiopathogenesis for type 1. Next, we'll see about the clinical manifestation. So, childhood diabetes is usually rapid in onset and may present with diabetic coma. Obesity plays no role in childhood diabetic mellitus. So the main clinical manifestations are polyuria, which means increased urination, polydyspepsia, which means increased thirst, polyphagia, which means increased appetite, nocturia, enuresis, weight loss, sleepiness, general weakness, tiredness, and bodily pain. Fainting attack due to hypoglycemia, abdominal pain, nausea, vomiting, irritability, vulvovaginitis in girls, poor wound healing, visual disturbance, skin infection, dry skin. So these all are the main clinical manifestation of diabetes. Next one is the diagnostic findings. First one is the history of classical triad symptoms. Based on the history, if anyone at family have history of diabetic mellitus, this can lead to diabetes. So the second one is the physical examination like blood pressure, body mass index, fundoscopic examination, food examination like lesions, signs of infections, skin examination, again any insulin injections, lesions, and neurological examination and oral examination. And also the laboratory investigation like random blood sugar, fast blood sugar, postprandial blood sugar, urine glucose, glucose tolerance. So these all are the main diagnostic investigations. So next we'll see about the management of diabetes. Diabetic mellitus is complex disease with multi-organ involvement. Management of diabetic mellitus in children involves the combination of insulin therapy, dietary management, physical exercise, prevention of complication, promotion of growth, emotional social development. We'll see about insulin therapy, the principles of therapy and monitoring. Elimination of clinical features of uncontrolled diabetes, prevention of DKA, which means diabetic ketoacidosis, avoidance of hypoglycemia, maintenance of normal growth and maturation, early detection of associated disease, prevention of emotional disorders, prevention of chronic vascular complications of diabetic insulin is formed from substance called proinsulin. The increased blood glucose level stimulation the proinsulin into insulin and connecting peptide and enters the bloodstreams. Insulin is produced in two phases. First phase, immediately after the glucose level stimulates, this insulin is already produced in the pancreas and stored. The pancreas can store 2000 of insulin a time. And the second phase is produced as per further requirements. Functions of insulin. Certain amount of insulin readily circulates in the blood which is called basal insulin. Insulin enhances fat storage and prevents fat mobilization for energy. Insulin stimulates glucose transporter to enable entry of glucose transporters to enable entry of glucose into cell for utilization as energy source. Also, insulin promotes glucose storage in liver and muscle as glycogen. Types of insulin. Insulin can be categorized under the following: species or source of insulin, duration of action of insulin, purity of insulin, concentration of insulin, trade names of insulin. Source and purity means we'll get some beef insulin, human biosynthetic, pork insulin, beef pork combination of insulin. So these all are under species or source of insulin. Based on the duration of action, there are short acting insulin, intermediate acting insulin, long acting insulin, and biphasic insulin. So the short acting insulin is classified as rapid acting, regular acting, plain acting, and solute acting. Next, we'll see about the complications. Complications are presented as acute, subacute, and chronic conditions. So, under acute complications, there are diabetic coma, hypoglycemia, diabetic ketoacidosis, infections. And under subacute complication include growth failure, poor school performance, poor psychological development, impaired neurological development, and under chronic complications include macrovascular retinopathy, neuropathy, nephropathy, hepatomegaly, boils, types, abscess, fungus infection, tuberculosis, high blood pressure, atherosclerosis, CCF, which means congestive cardiac failure. Blindness may also develop in the children having diabetic mellitus. There are some nursing management. So the nursing diagnoses are fear and anxiety related to long-term illness. The second one is imbalanced nutrition related to imbalance of insulin, food and physical activity. Risk for injury related to hypoglycemia. Fourth one is risk for injury related to insulin deficiency. Fifth one is risk for infection related to hyperglycemic state. Sixth one is risk for fluid volume deficit related to polyuria and dehydration. Seventh one is potential self-care deficit related to physical impairment or social factors. The last one is knowledge deficit related to care of a child with newly diagnosed diabetic mellitus. So this is about diabetic mellitus. Thanks for watching. Bye.